Hey, welcome back, America, to your Caribou Data Science channel. Let's see something. What do we got here? 10 plus 1. A big shout out to the 11 people who watched this video yesterday. I know for a fact that each one of the 11 people know one other person who's interested in the COVID-19 situation in the U.S. today. All right? Before we get started, I just want to, of course, again, thank you for the 11 views. Don't forget to subscribe. Don't forget to click on the share button. Share this video on Facebook and Twitter. You can also cut and paste the link to it into your email or text message and share it with your friends and family that way. Of course, before we get started, I want to share with you a brief post I had on Facebook with a person. In the middle of his post, he says, "Well, my wife came down with you know what. Of course, you know what means COVID-19." And I replied back. I said, "Did she get the vaccine?" Okay, and he said yes, fully. This brings us to the point of a very sobering fact about the COVID-19 vaccines in America. Okay, and that is that the COVID-19 vaccine in the US will not keep you from getting COVID-19, and it may not keep you from dying from COVID-19. Okay, it may reduce the symptoms of COVID-19, it may reduce the chance you die, but it comes with no guarantee. So my question is this: at what point do we get on with life? At what point do we lace up our boots and get on with life? At what point do we accept the fact that COVID-19 is not going away? Going forward, how many deaths and cases a year are we going to accept as being normal? Keeping in mind, we have between 500,000 and 600,000 deaths from cancer every year, from heart disease, okay, in the U.S. Does that mean 3 to 4,000 deaths from COVID-19 is going to be normal? We're to the point where we really start giving this some serious thought, okay, serious consideration that it isn't going away. And so far, I've looked at today. I've looked at Sweden's, I looked at Israel's, and looked for the state of Ohio numbers, and all three of those so far have shown an increase in cases and deaths beginning in mid-July. If flu can have a season, then why can't COVID-19 also have a season? Okay, let's get on with the show here. One of the other things that's curious about COVID-19 as opposed to heart disease, that for diseases like heart disease and cancer, the count is reset to zero every January 1st. But with COVID-19, we're still counting it from January, the day of the first case, and from March 1st, the day of the first deaths. Why are we counting these different? Okay, we should be counting each year as a separate year. So anyway, since January of 2020, we've had 38 million cases. Since say March 1st of 2020, we've had 632,000 deaths. Here's the current year. We had a long declining pattern. Now again, there's that mid-July number. Okay, there's that mid-July number. Okay, I should do a shorty about that, about my little rant there. You know that? All right. Anyway, I wonder if it'd be possible to film a shorty using this. Okay. So anyway, you can see this increase here. We need to ignore the volatility, the day-to-day volatility, because this middle number is more important. So right now, this is say 150,000. So right now we're probably about 150,000 deaths on average per day, or cases per day. Deaths, again, average maybe 1,000, maybe 800 to 1,000 deaths per day right now. You can see here, this is the total cases for 2020 versus 2020. You can see in all probability, okay, we're going to deaths in 2020 are going to catch 2020, probably even pass it. Although this was from cases, this is from January. Yeah, so this is 12 months worth of data. This is 8 months worth of data. What about deaths? Well, again, this is 8 months data. This is 11 months data. So with 8 months going in the year, we've almost caught 2020's deaths. But I think the important thing is, while we may catch it, the actual number of daily deaths is slowly declining. Okay. So now let's compare 2020 versus 2021. You can see 2020, all we had was an increase in cases. But 2021 began with a long declining pattern. Again, the decrease in July. Look at this, a decrease in deaths in July also. Really curious, isn't it? Okay, so that's three countries where we saw, three countries in one state where we saw cases and deaths beginning to increase in the first part of July. Okay, here's the actual numbers here. Okay, but let's take a look at the moving average. This is so for the 7-day period ending August the 18th, we had 1,400. We had 144,700. We're averaging 144,740 cases per day. What about deaths? For the 7-day period ending August the 18th, we were averaging 938 deaths per day. Here you can see this spike up in cases. What is 1, 2, 3, 4, 5, 6, 7 months increase. Hopefully, this is the beginning of a new decline. Okay. 1, 2, 3, 4, 5. A 5-month increase in cases, but still below 750 cases. Okay. Well below this number here. Monthly cases, well, you can see that August cases will be the highest number of cases in 1, 2, 3, 4, 5, 6 months. Deaths are still relatively low. It's going to be the highest, most number of deaths since April. Okay, but it's still 1, 2, 3, 4, 5, 6, 7 months in a row when the deaths been below the highs back over here. What's this? Well, this is a number of this is the number of people per 100,000 that has COVID-19 right now. So that number's right around say 40. So for every 100,000 people, 40 of those people have COVID-19 now. What about deaths? Well, this is one half a person, right? This is 1/4 a person. So somewhere, say around one, for every 100,000 people, let's say one half of a person is dying from COVID-19 in the U.S. right now. All right, America. That does conclude your report for today. Hope you found it interesting. Hope you also that you will click on that share button, share this video with your friends and family today, and also click on the subscribe button if you have done so already. And also, very important, click on that like button. 11 views should mean 11 likes. Okay. Thanks so much for your time, America. We'll catch you tomorrow with an updated report.